Is this PCOS? Let's find out. Welcome to Hormones and Health with Dr. Haika. My name is Dr. Haika Shu. I'm a consultant endocrinologist. PCOS, let's break it down by its name. Poly means multiple. Cystic refers to the follicles within the ovary, and our follicles contain our eggs. And syndrome refers to multiple symptoms that make up a condition. So in this case, it's the weight gain, the hyperandrogen state. Follicles are at different stages of maturity, making the ovary bigger. And all these in itself, the fact that there's multiple follicles, they're all producing estrogen, and that excessive amounts of estrogen is sending signals to the brain. And the brain, the GnRH, which is released from the hypothalamus, thinks, well, okay, follicle stimulating hormone, which is produced from the anterior pituitary, needs to dial down, and I need to produce the other hormone, luteinizing hormone. But what it does, instead of reducing it in a moderate amount, it releases it to excess. So you have this excess amount of luteinizing hormone, and that in itself is what stimulates excessive amounts of the male hormone testosterone, as well as the other male hormones that we call adrenal androgens that are secreted from the adrenal glands. So you have this excess state of multiple cysts and excess amounts of male hormone being produced. Another feature of polycystic ovarian syndrome is that although these multiple follicles are at different levels of maturity, they aren't at the state where they're mature enough to be released. So we aren't going into that second stage of the cycle. An egg is not being released. If an egg is not being released, that means that you won't form that corpus luteum that produces progesterone. Progesterone is the hormone that maintains the lining of the womb, and also when the levels drop, sheds the lining of the womb to give you a period. So one of the problems in polycystic ovarian syndrome is that women develop irregular periods, and you have abnormal thickening of the endometrium. And that in itself can be a problem because it can lead to a condition called endometrial hyperplasia. So you have a problem with your ovaries producing eggs but not releasing the eggs, and you have excess amounts of testosterone. This testosterone will stimulate different things. So it will lead to acne, it will lead to excess hair growth in a male pattern. So women can get facial hair, chest hair, back hair, and as mentioned, acne. It can also lead to what's called insulin resistance and obesity as a result of the testosterone. And all these things, aside from the symptoms, can predispose you to other problems with health in the future. So obesity, type 2 diabetes, and other conditions which are related to obesity like sleep apnea, fatty liver. So there are treatments available for PCOS. We'll talk about that in the next video, but hopefully you found this explanation useful. If you did, please share it with other people, and please comment below. And I'll see you in the next video. Thank you.